Hello, and welcome to our talk on understanding GLP-1 medications and nutritional strategies to enhance its effectiveness. I'm Dr. Lauren Young,
My name is Sarah Khan.
and we're excited to talk about this together with you today. Just a quick reminder that everything we talk about today may apply to you, but you want to talk to your physician about it. So again, the goal of this is to empower you to understand more about these medications and about nutrition and lifestyle medicine in general. But we recommend you work with your providers directly for any individual advice. Sarah, would you like to do your background?
Sure. So, my name is Sarah Khan. I'm a registered dietitian and a lifestyle coach for the diabetes prevention program at Manchester Memorial Hospital. I also have a private practice, and I usually do a special focus on weight loss, women's health, hormonal health, and diabetes. I'm also passionate about cultural inclusive and practical nutrition care and just finding ways for everyone to be healthy regardless of background.
Awesome. And again, I'm Lauren Young. I'm a naturopathic physician that's been practicing in the greater Manchester area for quite some time. I founded Collaborative Natural Health Partners, which is a combination of naturopathic physicians with primary care physicians, really focused on lifestyle medicine. In 2018, I was brought on by the hospital as medical staff as a naturopathic physician. And so my background and passion really is in mindful-based stress reduction with a relationship to food and nutrition. And I brought this to programs that we've done in our clinic in the past, really working on with groups of people on using peptides and mindfulness to create change. So the goals tonight, just to set everyone on the same page, is to understand what these medications are and what their indications are, to understand lifestyle mindfulness that can support these, as well as, and so that means nutrition, exercise, sleep, all the great stuff that we want to focus on beyond just using the medication for changing body composition. There are a lot of things we know that Sarah and I work on that improve the side effects and improve them and maximize the benefits you get out of this medication. So we want to kind of go over that with you as well. And just what does maintenance look like? What is you know, discontinuing the medication look like? What are your goals around all of this? We'll talk about all of that. So real quick, the two medications that or the two types of peptides we're going to talk about today are semaglutide and tirzepatide. The brand names are Wegovy or Ozempic for semaglutide, and then Zepbound or Mounjaro is tirzepatide. Um, the mechanism of action really is there's two different ones. So for semaglutide and tirzepatide, there's a GLP-1 receptor agonist. So this is going to stimulate um, GLP-1 receptors, and we'll talk about what that looks like in the body. And then tirzepatide is a second peptide function with this glucose-dependent insulin-tropic polypeptide. Those are some long words to say that they impact the body in a bunch of different ways. The best picture that really shows it is this one right here. So everything that is green is going to be something that's done by exclusively tirzepatide, but everything that's in red is both semaglutide and tirzepatide. So essentially, what's going to happen in your body is this medication doesn't just affect one thing, it affects a bunch of different things. It's going to make you feel more full. It's going to reduce your food intake. In some cases, with the GLP-1s, it may make you feel a little more nauseous because it's going to slow down the motility in your GI tract and slow down gastric emptying, which means you feel full quicker, but you also could have heartburn easier. You could get more constipated. It slows down motility in general. It's also going to reduce blood sugar. It's going to increase insulin sensitivity. It's going to help mobilize body fat. And you'll see the benefits of the GIPs, which are in green here, which again, it's going to help with glucagon. It's going to help with insulin resistance. It helps with lipid buffering capacity, and it actually can reduce inflammation as well that we're finding. So a lot of cool benefits to the entire body, which is why these medications are really effective and are getting a lot of attention. when we talk about the side effects of the medication, so one of the main ones, there's this great quote by a famous naturopath, John Bastier, said there are no side effects, there are only effects. So because we're slowing down motility in the GI tract, there's more risk for nausea, vomiting, or GI upset, abdominal pain, heartburn, those type of things. There are some rare cases of pancreatitis and gallbladder issues as well. Beyond that, the main side effects reported are headaches, fatigue, changes in mood, and this can, because it can affect delayed gastric emptying, affect medications. So you want to be careful, especially with oral contraceptives. So we'll dive into how to manage these side effects with the nutrition and lifestyle pieces of things, but that's just a heads up as kind of what can happen with them. Reasons why you should not take this medication: if you have a history of pancreatitis, if you have a plan to get pregnant within the next 6 months, you should definitely not take this medication, or if you are pregnant. If you have a history of diabetic retinopathy, history of eating disorders, I would highly caution, or gastroparesis, which again is like a slowing of the GI tract. We want to consider avoiding that as well. There is some contraindications with a specific type of cancer, and it's not all types of thyroid cancer, but specifically medullary thyroid carcinoma is a contraindication. So any of these things in your personal background, you wouldn't want to consider this medication. So today we're going to talk about some ways that, let's say you've been prescribed this medication, how can we maximize the results with it? So we're going to talk about just how to self-assess, some like really simple and mindful tools to bring to the table to kind of help set you up for success around all of this. On the left is a lifestyle wheel. So the numbers go from 1 to 10 on the way out. And what's around this circle, you may have seen other ones similar to this. This one's based entirely on lifestyle medicine or lifestyle options in your body, right? Ways to take care of your body. So 1 is like a low score, 10 being the optimal score, the highest score. You would rate yourself in all of these categories. How's your hydration? How's your movement, your sleep, your social? How often are you finding that you're mentally challenged and you're finding joy in your life? How much caffeine and alcohol are in your life? How often do you depend on stimulants or depressants to kind of manage your energy and mood? Environment could mean a couple things. How often are you connected to nature, or how stressful is your home environment or your work environment? Like, how are you being impacted externally? And then nutrition, where are we at with the amount of time you can put towards nutrition? How good do you feel about the nutrition you're putting in your body? Those type of things. So after you rate yourself, you may find some glaring categories that really stand out that you may want to focus on. And it may be interesting. It may not be around nutrition or even movement, the two that are really emphasized. So looking at that, you want to make sure you make the wheel as balanced as possible and slowly make it a larger and larger circle. I would suggest, and we'll talk about it more, that going into this, there are a few goals that we would recommend setting yourself up for success. And even if you're thinking about talking about this medication with a physician, I would start with hydration. Start making sure your cells are like little grapes instead of raisins, so that like when this medication is in your body, you're already starting with a well hydrated system. Um, the other piece of things is that people start on this medication and it is going to quiet down the food noise and make it easier to make good choices and skip on the desserts and things like that. So set yourself up for some really meaningful, measurable goals out the gate so that you can get some wins under your belt and really make get some traction with making changes lifestyle wise, not just leaning on the medication to make you not hungry. So we talk about SMART goals. We talk about specific, measurable, attainable, relevant, and time-based. All of those attributes will make a good goal. So I'm going to start on Wegovy, or Manjaro, and the reason for it is I want to lose weight for the summer and I want to lose 20 pounds. That's really still not a relevant SMART goal. We want to talk about, I want to focus on more vegetables or walking more or drinking X amount of ounces of water a day for the next 3 weeks. That would be a more SMART goal where we're making it small little bite-sized pieces of what our big goal might be. Um, I kind of touched on this, and Sarah's going to go into it at length, so I definitely want to let set her for success with this too. But we both agree that hydration, protein, fiber, and mindfulness are a great way to kind of approach um, setting yourself up for these medications. So real quick before we dive more into the nutrition, like what is mindfulness? One of my favorite phrases is in it but not of it. It's the idea of paying attention to the moment, yourself, your experience with openness and without judgment. And the nice piece of that is that, we'll quiet down the food noise. You won't want to snack at night while you're watching TV or things like that. Notice what else comes up. Notice that that was a pattern that was there before. If you can watch yourself in your life and notice these patterns, we can start to make changes more around them. Um, some of the interesting ones that you can, and we're going to send out these slides, so don't feel like you have to like jot all this down, but really notice when you are connecting to your like the things you tell yourself around food. We eat quickly, we eat distracted, we finish things because we think we're supposed to, we eat during certain times because we think we're supposed to. We undereat and then overeat. There's a lot of habits that may happen, and just kind of staying open to noticing your patterns. Again, without judgment, we all have these moments. That's why there's so many pizza restaurants on Friday nights. It's more about seeing the patterns in your own life and how to change them. Um, One awesome thing that can come from mindfulness too is noticing how full we are. So you're going to feel full a lot easier because your motility in your stomach. But there is this concept called Hari Hachibu, which is a Japanese concept of eating to only being 8 parts full. So the idea that you don't overeat or stuff yourself or eat to 100%. And it's a really neat concept that I think as we transition off the medications or before you start on the medication, noticing how full you get when you're eating. Do you need to feel like you have to fill your stomach all the way? Are you feeling like you're overeating? Kind of notice those patterns of how much we fill our bodies up before starting on the medication or even, like I said, afterward. Um, Mindful pauses are a great first step when it comes to to just kind of bring around mindful based stress reduction to food. So we want to talk about doing a quick pause and check in with yourself before meals. Just notice what's in front of you, what's your intention around your meal, again, without judgment. Why are you eating? What other things are going on in your head? What else are you doing while you're eating? Are you watching TV? Are you scrolling? Are you talking on the phone? Are you with your family? That quick check-in can sometimes make you realize like I'm really stressed right now and I'm gonna take a few deep breaths and kind of be present before eating this meal. Or I just have 5 minutes, I have to inhale this. At least you're being aware of that pattern, and that's going to help you make a more present decision.
All right, I'll take over with the nutrition component now. So let's kind of dive into that. So with nutrition, I think one of the most important things is eating enough calories, especially as you're going to have a lot of those hunger cues no longer existing or just very minimal, then you really just want to make sure you're getting enough food. So there's something called your basal metabolic rate. You want to make sure you're getting at least that amount, right? So that means basically your body can still function and everything, all the processes can still occur. So in order to make sure you're eating enough calories, just keeping track of your foods can be a great way of doing that. Working with a dietitian, obviously, you can kind of work together and just make those goals. A lot of the things we'll kind of talk about sometimes why you may need small balanced meals or avoid larger high fat meals depending on symptoms, but really just kind of achieving like a balanced diet. My plate method is a great way to do that. You see it all the time, but just really trying to get a little bit of everything, right? So everything in moderation is a great way to do that. And then obviously keeping up with hydration, which Dr. Young talked about a little bit as well, and just kind of knowing how much water you're drinking and then adding electrolytes if you really do need to replenish. So the other main things, and I think we both agreed on this without even saying it, we both agreed that protein, fiber, hydration, right? Those are the top three things here that are really important. So with protein, trying to get around 20 to 30 grams per meal is a great start off point. Obviously that can change depending on your needs. And then that, again, if you're working with someone and can dive deeper into that. But overall, for most people, 20 to 30 grams is a great place to start. Protein really will help maintain and build muscle mass. It'll improve satiety and helps to stabilize blood sugar. When it comes to fiber, trying to get 20 to 25 grams per day, most people are probably getting less than half of that. So as you increase your fiber, just do it gradually and increase your water with it. You really don't want undesirable side effects when it comes to increasing fiber all of a sudden. So just slowly increasing it can help prevent constipation, supports your gut microbiome, and just getting a variety of both soluble and insoluble fiber. When it comes to exercise, I think there's the two main types, right? So there's aerobic exercise and then there's strength training, which I'll talk about in the next slide. But with aerobic, think of your cardiovascular activity. So the goal is to get at least 150 minutes a week. If you're getting zero right now, maybe you start off at just 30 minutes a week, right? And slowly increase that. But the goal really we want to get to at least 150 minutes. So maybe that's 30 minutes 5 days a week, right? Just to kind of build up. And then thinking of aerobic, think of anything that really gets your heart racing. You're out of breath, you feel that. So thinking of walking, jogging, running. Here's some other examples with like cycling, swimming, dancing, right? But these really just improve your heart health, help improve insulin sensitivity, and give you energy as well. When it comes to strength training, I would like at least 2 days per week. And you want to do non-consecutive, so then you do want a rest day in between. So when we're working out our muscles, we really don't want to be doing multiple days in a row. So even if we're recommending 2 days, doesn't mean you just do it both Saturday and Sunday. You really want to kind of have a rest day in between. Um, Strength training will really help to build muscle, support metabolism, and improves bone health. Obviously, some examples of that, you could do body weight exercises. So those will be like squats, lunges, push-ups. You could use free weights, whatever you have at home, really. You don't need to go out and buy some things. If you have stuff at home, just use that, right? It doesn't have to be as hard. And then resistance bands as well are a great way of getting in some strength training. Obviously, the benefits of exercise are so many, and this list could go on and on, but just to cover a few here, improves blood sugar control and insulin sensitivity, really supports your heart health. It'll help lower your blood pressure as well. Maintaining muscle mass, especially when you're on a GLP-1, you may be losing weight at a rapid rate and end up losing some muscle mass. So you really want to help keep your muscle mass update like as much as high as possible, right? So really working out, trying to increase your muscle mass and make sure you don't lose too much. It helps boost energy, mood, helps with stress and sleep as well. And obviously with support, will only support in weight loss and weight maintenance, right? So really just so many benefits of exercise. When it comes to side effects, there's many of them, unfortunately. There again, we talked about them a little bit, but just to dive deeper on how to alleviate some of those side effects. So the biggest one being nausea and vomiting. So nausea may or may not be, sometimes some people just have it, and even if they do everything, it's really still there a little bit. Vomiting, I would say, is definitely you can kind of minimize that with foods. So if you minimize just high fat foods, that'll really limit the amount of times you will experience vomiting, hopefully never. And then small frequent meals. So if you're eating too much food at once, right, high fat foods really tend to just sit in your stomach. And if we're slowing down gut motility, then it's slowing down even further and just kind of sitting there after you eat any high fat foods. I just saw an example of this literally, I think earlier this week, where someone came in and was saying that they were throwing up constantly for the last 3 days. So I asked what they had eaten. They had eaten pizza and wings. So, and then I was like, okay, well, the combination and both high fat foods. And then she had said, okay, yeah, I ate the pizza and wings. And then the next day I didn't eat anything all day because I couldn't. And then I ended up eating the leftover pizza. So then she felt way worse the next day. So it was just way too high fat, right? So we really want to just be conscious about it. But we kind of talked about it. She understood and now made those changes, right? And hopefully won't see that again. But just knowing that these are all doable, right? Like there are the side effects, but we can kind of minimize them. There's obviously with constipation, the main three are fiber, fluids, and movement. Keeping up with your fiber, making sure you're hydrated, and then moving as well. Movement can really help with constipation, so that's a great way to avoid that. And then obviously the opposite with diarrhea, just making sure you're kind of lowering that fat intake as well, right? So lowering high fat foods, you can doesn't mean you can never eat pizza when you're on a GLP-1, just limiting it and then maybe pairing it up with the right foods, right? Because if you know this is a high fat item, maybe the rest of the day you're kind of watching how much fat you're having in that day. Um, and then having soluble fiber will help with the diarrhea as well. Other side effects, decreased appetite. Obviously, that's kind of a part of it. So I know like alleviating it seems like counterintuitive, but it will help because you still need to make sure you're eating enough, right? So snacking can really just help you increase your caloric intake. So if you feel like you're not eating enough, having some healthy snacks in between, some healthy, just pairing them well, right? So we always talk about no naked carbs. So don't eat carbs by themselves, really trying to pair them with either fiber, fat, or protein. Small, frequent meals will really help because, again, that food isn't sitting in your stomach for long periods of time. Fatigue is a common side effect as well. So just making sure you're getting an adequate amount of calories, proteins, hydration is really going to be important. And then increasing your fruits and vegetables, keeping up with your vitamins and minerals is really important and will play a big part in the fatigue. And then overall, just keeping track of your triggers, right? If you keep track of all these triggers, your foods, then when you go to your healthcare provider, if you go see a dietitian, you can talk about this and know exactly what's going on. So trying to be a little bit more in tune with your body, but just jotting some things down. You don't have to go buy a journal, just jot it down wherever. Have some notes to discuss when you talk with your healthcare provider. To maximize the benefits of the drug, right? So while you're on it, really you want to build skills, not dependency. So the drug will really help you lose weight. However, we really want to build good habits while we're on it. So weight will fluctuate throughout, right? You'll have ups and downs, not being too hard on yourself. Be patient, be kind to yourself. If you would like to kind of know a little bit more, using a body composition scale can help really see the fat mass versus muscle mass, and then to make sure you're not losing too much muscle. And then working with a dietitian obviously can be helpful. We'll kind of talk you through healthy eating, building healthy habits, and then it just really just keeps you accountable. That's the main thing. And then again, like I said before, keeping that journal, same thing. You really want to know your symptoms, all the things that really just come up, your triggers, and that'll help if you keep a journal, so then you can discuss how to alleviate some of those symptoms.
I know we've talked about too that like understanding your goals around it all as well, that our goal is not to have rapid weight loss, but it's like a slow 1 to 2 pounds a week is a reasonable amount that your body then can process all of that and you're losing it in a really sustainable way. And oftentimes I know we both see people plateau and that's okay. And to focus more again on the behaviors that you're using this tool to shift instead of I'm taking this drug to lose weight or I'm taking this drug to control my blood sugar, and that perception shift is really about the goal here, which is using this as a tool to strengthen your behavior.
Yeah, no, I totally agree. And I think it's a resource and using it as a resource, not as this is the only thing helping you lose weight, right? This is
Absolutely.
just an extra resource you have now.
Mhm.
And I think when it comes to like, so we kind of talk about like the long-term considerations versus short-term. So just thinking about how you're using the drug. So if you're planning to go on it, really talking with your provider before you even start of what's the plan, right? Does this look like something you're going to be on for 1 year, 2 years, 10 years? What is the goal? So planning it out beforehand can really help how you're going to increase the dosage, how you're going to be on it, how you want to plan around it. So you can plan and then your healthcare provider can plan as well. But your symptoms and appetite obviously will change throughout, right? Your body gets used to the medication. So you can be on the same dose that before maybe you weren't able to eat, you were only able to eat a couple bites of food, but now you're able to sit down and eat a whole meal. Your body will adjust. So making same thing, right? Make that plan with your provider on how to increase the dosage, especially if you don't want to max out too quickly, right? So this dose, obviously, there's only a specific amount of max dose you can go to. So if you keep increasing your dosage month to month and your healthcare provider is agreeing with you to increase it month to month, then I mean 6 to 8 months later, you're going to be at the max dosage and then you may not lose as much, right? So we really want to see slower weight loss. I know people go on the drug and want to lose it fast, and everyone wants to lose it by tomorrow, and I get it, but really slowing that down can be the best thing for you. You'll see less side effects when it comes to slower weight loss, and you'll see that weight loss last much longer, right? We've all seen someone or heard of someone that has lost the weight really quickly, and then we see them next time, and then they've gained it all back and more sometimes. So, really, the way to limit that is slower weight loss and let your body adjust to it. Um, some of those hunger cues will come back, right? So, you may feel hungry and you're like, why am I feeling hungry? I'm not supposed to be. That's all right, right? Again, treat your body kindly, be patient with yourself. We kind of talked about a little bit of a plateau, right? That might happen. That's all right. Some weeks you'll plateau for a little bit, and then other times you'll drop a little bit, right? So at the end, we just want to see average weight loss, not every day, not every week, right? So on average, if you're still on a decline, I'm okay with that, right? If that's the goal, that's all right. And just obviously learning and maintaining healthy habits while you're on it. Use this time wisely, I would say, and really build your habits because once you get off the drug, at least you have those habits keeping you going.
Absolutely. I love all that. And I know we notice the lower the medication dose you can be on, the better for longer. Like really like the goal is to get the appetite suppression there, but not so severe that you're like not eating at all. But basically, as soon as you have any amount of appetite suppression where you feel like you can kick in those healthy habits a little bit extra, that's where you should stay as long as possible. I agree with you on that. There's also every time when you start the medication and when you increase the dose is when there's a little bit more side effects I've found. And also the appetite suppression is a little more extreme in the very beginning. And then it kind of eases up both the side effects and the appetite suppression. So if you do like one dose and you're like, whoa, I'm really nauseous, it may quell over time as well. So just something to be mindful of.
Yeah, and I think a lot of people actually recommend now, like to take, so especially right when you're starting, to start it on a day off since you don't know what your symptoms may be. So
Mhm.
just in case, plan it for like maybe a Saturday or Sunday, whenever your day off is, plan it to take it then, and then knowing that the symptoms may come on really strong, but they'll kind of diminish throughout the week, right? So again, people usually plan their like shot day accordingly and just will work around that.
On that same vein, I know we're riffing here, but is not ignoring the side effects. Like if you have nausea, if you have constipation, do not just power through and bring this up to your provider right away. You should be having regular bowel movements. You should not be having appetite suppression to the point of nausea where you can't eat or you're vomiting. Like those are not okay symptoms to be suffering through for the goal of a better body composition. So it's really important to not let yourself get super constipated, especially on this medication. So bring that up to your provider right away if you're noticing those side effects.
Yeah, and even planning for like a follow-up within that first month, right, while you're
Mm.
on it
Mhm.
before you don't want to go a long stretch without it, or just especially if your doctor gets booked up, then you want to make sure you have something there, right? You can always cancel it, but booking it ahead of time and just planning around that. I think
That's an
that's pretty
excellent
good.
idea. Yep. Yep.
So when it comes to short-term use, so short-term, I just around less than 5 years or so, then really utilizing this time wisely because this is the best time to build your better habits, right? Again, you're planning to get off this drug, so then you really want this to use this time very wisely and just have your habits, right? So the way I look at it is afterwards, many people will say, well, I'll gain weight if I get off of it, or that's what people think, and that's kind of their thing of not taking the drug, right? So it's like, okay, if you don't want to take the medication because you're going to gain the weight back, maybe we can plan accordingly while you're on it. So really coming with a plan and having that in place will help you. So for example, if you're planning to be on the medication for the next 2 years, then start now where, all right, let me start. Maybe I'm going to become active first. That's my first goal. I'm going to start working out 1 day a week, and then I'll increase to two and then maybe three, right? So now you have the habit of working out. So even once you get off the medication, you still are working out, right? You still have that habit in place. Maybe you have a gym membership, you're paying, it's keeping you going, right? That's just one example. There's so many more, but really that'll really help keep you going. Some weight gain is normal, it will occur. That's all right. Again, be kind to yourself. I don't like to be fixated on the number on a scale I think when you even have a weight goal in mind, putting a range to it. Put like 5 to even 10 pound range of where you want to be. Don't give yourself, I want to be 140 pounds and that's exactly what my goal is. No, not, I think give it a range. So then if you're within that range, that's where you are because your body fluctuates, right? Everyone's body fluctuates. You can weigh yourself in the morning, right, on an empty stomach and you're at your lowest versus end of the day or maybe after a bigger meal, then you're a little bit heavier, right? Our body retains fluids more sometimes. Being kind to yourself, but give yourself, I would say, a range instead of an exact number for your weight goal.
I love that. I love that. So again, I love the idea of journaling on some of this because I think there's so many lessons to be had here and being mindful of and taking them with you. So these are just some quotes that I had from patients, like realizing that we eat food because we think we're supposed to finish our meal, or the reasons we're eating are not necessarily for nourishment or for what our body even wants. So once we turn down that like feeling like we have to, knowing that this medication won't even let us do that, even if we feel like we have to, that gives you permission. And so I had one patient actually that would write themselves permission slips that they were getting from the medication, permission to not finish a meal, permission to say no to birthday cake, you know. And now they have those permission slips going forward, which I really loved. Um, this is an opportunity to use this really awesome tool to develop a new relationship with your body, with food, with expectations around all of that. And so really take this as a learning experience, however long you're going to be on it, and an opportunity. Um, So definitely the take home message, right? We said is protein, fiber, hydration. We both are on the same page with all of that. If you start to have any side effects, it probably could be somewhat addressed with either talking to your clinician or making sure you're getting those things. Those things make a big difference. I love the idea of the body composition test because, like Sarah said, we want to make sure we're not losing muscle. So getting a baseline, one of those, there's a lot of them in gyms, they're in a lot of different doctors' offices, just to get an idea of where you're at muscle mass wise. So we're focusing on shifting your body composition, not just shifting the scale. Um, this is not you just starting a medication. This is you committing to making some lifestyle changes and really investing in your body and improving it. So really look at all aspects of your body so that we can see some improvements. Make sure your sleep is really in a good space. Make sure you have some movement goals. Look at how we can manage stress. And obviously nutrition is definitely going to be a piece of it as well. Um, working with someone like Sarah or a naturopathic physician or someone who's used to working with someone on peptides, set some sustainable goals that are little steps towards your ultimate goal, assess where where your lifestyle wheel is and kind of make some meaningful steps that aren't overwhelming. Um, and one of the biggest predictors is, having an accountability buddy or a family member, friend, your partner, or, if you don't have anyone who's in the same commitment goals for your body composition as you, like get a clinician on board to kind of help you with all of this. One of my things is like your mental diet and through this whole thing is just as important as your actual nutrition diet. And so making sure you're giving yourself the message that like you're making a lot of lifestyle changes right now, you can do this, that kind of thing. Any other tips and tricks, Sarah?
I think just being patient with the journey and not having high expectations going into it, right?
Mhm.
Everyone's so different when they start, and everyone's going to be different with how they lose weight. And if they lose weight, some people, right, it's not it takes a lot longer. So just be patient with yourself. Don't have high expectations. Again, it's another resource. It's like using the gym as a resource, using food as a resource. This is just
Mhm.
another resource and doing just that with it.
Awesome. Awesome. Well, thank you everyone for listening tonight, and we look forward to doing more of these. So if you have any interest in certain topics, you can certainly write ECHN or now Hartford Hospital and let us know, and we'll put more of these together for you. Thank you
Yeah,
so
thank
much.
you.